that's really interesting. I wrote a book about it. So what interests me about industry funding of research is that there is an enormous literature. I mean, a huge research literature on looking at the effects of industry funding, mainly chemical industry funding, cigarette industry funding, and pharmaceutical drug industry funding. And the pharmaceutical drug industry funding research is the easiest to relate to because it shows that if you give a doctor if I give you a pen and a prescription pad with a drug logo on it, you are going to change your prescription habits to prescribe that drug more often, and you are not going to have the slightest idea that you're doing it. That's what the research shows. Mm-hmm. So the insidious thing about corporate funding of research and of these kinds of practice elements is that people don't realize that they're being influenced. So what the research shows is that drug industry funding, for example, has an enormous impact on prescription practices, which is what they're interested in, and that the physicians who receive the funding don't realize it, didn't intend to be influenced, don't recognize the influence, deny the influence. So I tried to do the same thing for food companies, to see what the literature said on food company influence on research. There's much, much less research on food companies than there is on drug companies. Drug company research got 50 years of it. Mm-hmm. I mean, it started 50 years ago. Food companies much more recent. But the early results are the same. So food company, it got so, I was so annoyed by seeing food industry funded research, I could tell it by the title. I could look at the title of a study and think, who paid for that?
Like your grape post on your blog.